Clear Voices of Hope is a powerful collection of voices from For the Love of Cups, Clear Pathways program, dedicated to raising awareness about the realities of dense breast tissue and breast cancer. Through honest conversations and personal stories, we amplify the voices of women who have faced these challenges firsthand, sharing their journeys, fears, triumphs, and lessons learned along the way. Each episode brings you closer to the lived experiences of survivors, advocates, and caregivers, while also featuring leading experts in breast health and women's health. Together, we break down the barriers, provide vital education, and empower listeners to make informed decisions about their own breast health. Whether you're navigating your own diagnosis, supporting a loved one, or passionate about women's health equity, Clear Voices of Hope is your source for real stories, reliable information, and a supportive community. Join us as we shine a light on the path to early detection, better care, and hope for every woman. Liz Powell, thank you so much for being here and joining me today on Clear Voices of Hope. I am so excited to have you here. I've been a little bit of a fangirl of yours for a while. I am passionate about the work that you do, about the work that we do. And I just want to let our audience know that how we got connected, and that was me stalking you, honestly, and the work that you do, because it's really powerful. And I think that you do it in such a way that really brings community together, which is a core value and belief of mine, especially when we're talking about women's health. And you were putting together an event on the Capitol. It was a Capitol Hill Day for the Early Breast Cancer Detection Coalition. And I know that is one of the many areas that you focus on, because you really have the women's health advocacy group that you're a founder of. That I'll let you explain that in a minute, because I think you'll do a better job of it. But it's really anything that affects women's health. And it was the Early Breast Cancer Detection Coalition that drew me in. And I just took a chance on what you were doing and just sort of the energy I was picking up from the work you were doing and the community you were building. And I thought, if this is as good as it seems, I want to be a part of this, not only just from a missions standpoint, but from a value standpoint, and that you really are building this really incredible network of powerful women that are dedicated towards making meaningful change, even when things appear like we are just up against defeat after defeat. If you're looking at the Capitol, sometimes it can feel overwhelming. And I think you bring a lot of hope to this space and a lot of encouragement. And I just want to say, when I got there, I was just immediately met with warmth, with belonging, with inclusivity, just welcoming. You were so warm and helpful. And I know you were busy. I know you had a million things going on. And I was just really overwhelmed and impressed with how you were able to really walk the walk, and not just making things happen, but really do it in a way that makes it joyful, honestly, and a lot of fun to be a part of when we're dedicated to tackling some really hard things. And so it was a great trip. I can't wait to do it again. I'm excited because we do see change happening. We do see this work that you are leading having an effect and being able to actually benefit people. So I'm going to slow down here just a minute and allow you a minute to introduce yourself, and just know that I'm so excited to dig into this conversation. If you could just let us know a little bit about yourself and your background.
Yeah, absolutely. And thank you again for having me. It's an honor. And Lisa, I remember first meeting you. You had just come up the steps and you were front of mind. I wanted to make sure I gave you this book that was actually the Menopause, what's it called? How to Menopause book. And I remember meeting you, and you had just come up the steps, and it was July, so it was steamy hot. And I do remember that first interaction and being like, welcome, I'm so excited you came. And I was thrilled because I had met you before, and you just like flew in and did it. So it's that kind of action that really makes a difference in the world. So I just wanted to tell you, I definitely remember that first interaction, and that what you're doing really does make a difference. So thank you.
Yeah. Oh, I appreciate that. Yeah, it was hot. I suddenly had a new appreciation for everybody working on the Capitol. I'm like, oh, this is why they wear sneakers. Oh, this is why we wear layers. Don't bother with makeup. Yeah, it was.
Yeah, it was like melting. Yeah, DC. I mean, it is a swamp, right? So it's like that in July. But But my background, so I worked on Capitol Hill as a legislative staffer. I was a legislative director for two different members. One co-chaired the Women's Caucus. So I did a lot of work with the Women's Caucus. She was also active in the Congressional Black Caucus. So I was active with that as well. I staffed the Small Business Committee, and then I switched for a different member and I staffed the Armed Services Committee. Throughout both offices, though, I always did health policy and was always very passionate about health. I'm also a lawyer and I have a master's in public health, which I juggled while working. And I always loved meeting with patient advocates. They were always the most compelling. To this day, I can remember some of those meetings. It always hit me really deeply. So you want to connect intellectually, that's important. But when you connect on that deeper level, that's what really sticks with the staff. And it's that storytelling, that compelling storytelling that just really stuck with me. And I've always loved advocating for causes I believe in. And so I started my own consulting firm, G2G Consulting, which stands for Government to Growth, because I met a lot of folks doing great things, but not necessarily knowing the ins and outs of how to navigate government, how to shape it, how to do that advocacy effectively. And so now, all these years later, I've done a ton in the health space, interestingly connecting a lot of health innovators to Department of Defense because it has the most money. So a lot of our innovations, even breast cancer, our biggest research funding account is actually in Department of Defense. So there's lots of avenues through that. And I had a couple clients here or there interested in a women's health issue. I had a maternal health client trying to prevent preterm labor, which is the number one cause of infant mortality.
Yeah.
We did a congressional briefing. You could hear a pin drop. People were so immersed in that. And I remember feeling like, wait a second, I think there's something here. I started to work a little bit more and I saw that these were not one-offs, that there are systemic problems in women's health. And that we, instead of just doing breast cancer, just doing ovarian cancer, just doing maternal health, let's bring it all together. And that's how I got that idea for Women's Health Advocates, which is covering all of women's health head to toe over the lifespan. And we have a really active breast cancer group called Breast Cancer Early Detection Coalition, as you mentioned. And we've got some other active groups within it. But that holistic, all of us, all of our lives, you know, I think that's really important. And what we're finding, the science is showing that there's connection between when you have your first period and then your experience with your period, how that factors into when you try to have babies and then transition to perimenopause, menopause, heart disease. Like everything is on a spectrum and it's connected. And so the more we look at that and look at us as full human beings, I think the better off we'll all be.
My goodness. Yeah, absolutely. I mean, chances are we're never dealing with one thing and we are whole beings. So it makes complete sense that it would be under one umbrella. And I really love the way you brought that together. One, because we are women, it seems, you know, like the natural thing to do. We take a natural holistic view of things anyways, and in just the way we operate. But also it's satisfying for someone like me. Yes, my main focus is early breast cancer detection, but I have so many things that I care about, much like what you were doing. You had several clients and of course we're affected by multiple things. And so it's really wonderful to be able to feel like I have a pulse on those things too, and that I'm able to support where I can if I can. I'm just one person, but if there's anything I can do in any of these areas, of course, it makes sense. And why wouldn't it? When we go through menopause, of course, it's going to potentially affect our heart health in other areas. So why are these two things so separate when really it's really one and the same? And so I think the more we can do that, the better. And I think that you're really leading the way in that. And the fact that you have all this know-how on the Capitol is just incredible, because for someone like me, that it's so foreign. I have no idea. I would have no idea where to even begin. And so in the past, I really haven't. I thought, you know what, that's for other people to go and do. But to be able to say, okay, I can follow these people there. Liz knows what to do. I can trust her. And this is where I can lend my energy and my effort in a way that I know that's going to be impactful, because you've really done a great job of letting us know, like, it can be as simple as this. This makes a difference. This makes a difference. And even just you letting us know, and I can speak from now experience, that how important it is to have those survivor stories. Sometimes you feel like, as just a patient or just an advocate, that you're not doing enough. You're not qualified. You don't have the experience. You're not an expert. But I was really blown away by the fact that that actually has a really incredible impact, and they do want to hear from us, and they do want to hear those stories. And so I think that was one of the biggest takeaways for me, feeling like I actually can make a difference here.
Yes.
Yeah, I just love that approach. And I just love that you're leading the charge on that end. And I kind of want to shift gears a little bit. You're on the front lines of all of this. And I know we got some big news today that I'm very curious and excited to dig into as much as we can in 30 minutes. But there was news on the Capitol today. The FDA made an announcement that they are removing the black box label warning for hormone therapy. And I think that this is big news for all women. I'm going to put my breast cancer hat on now as a breast cancer survivor who had hormone positive breast cancer, and even for my sisters and my family members, because my mom also had hormone positive breast cancer, we thought we were not candidates for this. Nobody even discusses hormone therapy with us, right? It's just, we've always thought it was just a straight no. And I think that's not the case. And I think a lot of women live with that fear or just that old story that maybe just isn't even true anymore. So I'm curious if you can give us a little bit of a background on that and sort of the significance of the announcement today.
Yeah, it's huge because the Women's Health Initiative, the way the data and information was applied was very unhelpful. So the Women's Health Initiative was a study, but the average age was around 65. And they are finding that if women get on hormone replacement therapy or hormone therapy while they're in perimenopause, that is when it's most effective in early stages of menopause. It's not when you're later and already have gone through all that. So it was the wrong audience in the first place. And also it was only a slight change, very, very slight change for breast cancer. And in fact, it lowered the risk for heart disease, cognitive decline, all these other things. So the media went crazy when that came out in the early 2000s. And suddenly we went from about a quarter of all women using hormone replacement therapy to down to 5%. And
wow.
so many women, millions of women were really negatively impacted by that extreme overreaction to sort of an inappropriate application of data. Today, fortunate enough, I got to be in the room when the secretary and then the FDA commissioner announced that they are no longer going to have black box warnings on hormone therapy. That is huge because now doctors know that it's safe. They can talk to their patients about it. Patients can ask their doctors about it. There's still to this day doctors that are nervous about prescribing it, especially if a woman has any kind of hereditary connection to breast cancer. So it's huge and it's based on evidence. There's tons of data that backs this. So we're just thrilled with this announcement today.
I am too. I'm excited to learn more about it. I have to be honest, it's an area that I haven't studied enough of, but it's great news in that it opens up more opportunity. And like you said, the benefits of it could be life-changing for somebody that's, whether or not you have a risk of breast cancer. I think that this can just open up a lot of relief for so many women. And so I think maybe we can talk later about bringing one of those hormone health experts on next and digging into some of those questions. Yeah. I think it'd be really great to understand that a little bit more in depth about, even just some of the benefits. I can speak just from, my friends and the conversations and the ones that are taking hormone therapy and the ones that are afraid of it, and just really understanding the effect that can have on your life. I don't think we even understand how much that is affecting quality of life when we don't allow ourselves to look at some of these things.
100%. I mean, if you think about it, the symptoms, there's like 100 different symptoms affiliated with perimenopause and menopause. It's both because it's like several years of your body fluctuating, the hormones fluctuating. And so everything from not getting sleep to hot flashes, to brain fog, to mood, shifts, sudden mood shifts, like all these things. And if you pile it on top of each other, it's really hard. And then you have to go to work and you have to care for your children and care for aging parents, in addition to not getting enough sleep. And so it really does impact not just the woman, but everyone in her circle, in her community, in her family, and then the workplace productivity. There's studies showing that it's impacted our economic output. So everyone wins. It's literally everyone wins from this new decision making hormone therapy accessible. It's, individualized care. Talk to your own doctor. I'm not a doctor, but at least now available. Yeah.
Yeah. Yeah, absolutely. Well, and I think the stories matter. I think our experience matters as much as they do on the Capitol. They help us, figure out our own questions to go ask our doctor. And I think it's really important that, we share these stories with each other as best we can. But of course, also, I'm not a doctor either. But I do like to speak as openly as I can, depending on what platform we're using. But I think it's helpful. But I do have a question, just as a fellow female entrepreneur. Your energy level is next level. How do you keep up with yourself? You are all over the country. You are doing incredible things. How do you maintain your energy and your focus with so much happening in the world right now? And yourself, right?
Yeah, that's so nice of you. I mean, honestly, I am super passionate about what I'm doing. And I think when you love what you're doing, it's pure joy. I have traveled the country from East Coast to West Coast, in between Chicago, Detroit, New York, Boston, San Francisco with you, about to go to Los Angeles, Philadelphia, like all these places. It is that same energy around, wait a second, I have had some health experience. I wasn't believed. It took too long to get answers. We lost a friend to a health condition, whatever it is. Everyone has something that's touched them and they want to do something about it, and people are frustrated and they want action. And so, which is why I love how we started the call with your action. You were like, I'm seeing this is happening. I got a story. I'm just going to go. I'm just going to go to DC. I don't know anyone. I'm just going to go for it. And that decision single-handedly had this tremendous ripple effect because you shared your story in those meetings. You made this incredible network of friends. Now you're building this community and people are feeling like my voice matters. And that's so important because it does. And that's what energizes me. I go across the country and I get to share updates on what's happening in Washington, give a bit of training on how to do advocacy and how to make that voice really count in our political and our legislative process. That's like super important. And it's awesome.
Yeah, I love that. You bring so much good energy. For the women listening to this right now, right, that might be feeling a little bit either overwhelmed or frustrated about what we're seeing in our social feeds every day, all day long, which really looks like a lot of discouraging news, that's feeling like she isn't being heard. What would you say for somebody in that position that just, one, on how you stay hopeful, and two, on what you can do about it, right? When you're just feeling like you don't even know where to start.
Yeah. First of all, that's totally normal. That's the majority of people. Mm-hmm. And you don't want to just step over those feelings. Those are legit feelings. And anger is powerful. And you can use that anger in so many ways. You can use it in a destructive way. You can use it in a productive way. And a productive way is to engage in our government. And so we have ways to make it easy. You can sign up for our list, womenshealthadvocates.org. You can sign up, start to get our updates, find out about our events. We also have an online advocacy tool where we write the letter for you and you can pick the topic. So of course we have the Find It Early Act, which is all about coverage for early screening for breast cancer. We've got another letter on funding and language around women's health that's in current legislation that's pending in Congress now that hopefully they're reopening again from the shutdown. But the letters are there for you. Those are just a few examples. There's several letters. You pick the letter that resonates for you. You put in your address so that it comes up with your members of Congress, and then add a couple sentences that personalizes, I'm a survivor, or I lost my mother to this, or, whatever your connection is. And then send it. And literally it's less than 5 minutes. It's probably 3 minutes. It's super easy. And just doing that once or twice, you start to see, ooh, I can do this. And then you start dialing into our calls. We have our monthly calls every first Wednesday of the month, noon Eastern time, 9 a.m. West Coast time. And we give you an update. This is what's going on. And this is how you can be an advocate. So we're trying to make it easy so that you can just dip your toe in the water, see what it's like. And then as it feels comfortable, you get more and more involved, or just kind of stay back. It's really up to you. But the most important thing is to know that this is our country, our democracy. Each of us is a constituent. We actually are paying for our members of Congress to be doing their jobs, right? Our agencies to be doing their programs. So we have a voice in the system, and it really does matter.
Yeah, I love that. And I think you really have created some very accessible and easy to use tools that make it feel like you could do this and it's not going to take up too much time. You don't need to go and, think you've got to dedicate a whole day to figuring this out. You've really made it simple and streamlined, and all you have to do is tell your story, which you're an expert in already. So I am actually really grateful that you mentioned the anger piece, because I think sometimes that comes up as a trigger. I will share just a little bit anecdotally. My daughter the other day, she's 30 years old, and she was telling me, she just said, "Mom, I don't know when I became political." She goes, "When did this happen? I'm only 30 years old. Why am I sending my friends all these things that are so politically driven?" And I said, "Oh, honey, welcome to your feminine rage era."
I love it.
So this is what we do now.
Put it to good use. Yes.
Yeah.
Absolutely. Yeah. I mean, social media is a whole nother platform we haven't talked about, but the social media campaigns have shaped a lot of things. I mean, if we think back on IUD placement, so painful. There were something like 30,000 TikTok videos of women sharing how painful this was, that it actually shifted how the CDC was measuring and validating pain. It changed the practice, right? So social media has a huge role to play in driving change, not just, advocating in Washington. All of us can do that sitting right where we are.
Yeah. Well, that's where we realize we're not alone, right? When we realize that, there's other people experiencing this. And that's that piece where we were just talking on of just sharing your story, because one, it validates that you're not alone, but then it builds momentum and shows us where we've really got things wrong. And we're not crazy, right? Yeah. There's something we can do about this. We got to change the story for, on the Capitol, but also within ourselves, so that we feel like we can do something about this. This isn't right, and we don't have to live like this. I think that's huge. And then, in much more, other more global issues, but especially here in the United States, like you said, with infant mortality, I mean, these are very serious things that we can address, and we actually can change, and we have the ability to. So let's do it.
Exactly.
It's like,
let's do it.
It really wouldn't take much. I think we have everything we need. And even with the Early Breast Cancer Detection Coalition, we have everything we need. We know a lot of these issues, and they're solvable. So we just need to do it. We need to make this happen. And when enough of us get together, we can.
Exactly. Yeah.
Okay, so I have a question. You have built this incredible community in a very short amount of time. So let me back up a minute, because I'm not even sure when you originally founded Women's Health Advocates, but I think it was this year or just last year, but I know it was very recently. But you have built this.
We officially launched it, but I was building it from election day on. Yeah.
Okay. Yeah. I mean, that's still very quick, right? So just even last November, maybe. So a year. I'm curious, what's the secret, or what was the intention behind that? I know obviously bringing women and voices together, but you've done it and it's working. So I kind of want to know, like, what's the secret sauce there? And is it what you thought it would be, right, when you first started out to build it?
That's a good question. I don't know if I know secret sauce. I will say this, though. When the White House announced the White House Initiative on Women's Health Research back in, when was that, the fall of 2023, I was like, okay, this is and I had been meeting with them over the summer leading up to it with a few different women's health groups. And so immediately I was like, this is a huge opportunity. I could tell that they needed help. They didn't know everything on women's health. They needed to rely on all different aspects of the ecosystem, the investor perspective, the executives, entrepreneurs, founders, innovators, the researchers, clinicians, patients. The insurers who's paying for it. Like, they needed all those different perspectives to come together. And so I was like, this is an opportunity. So I just started reaching out to my network. Let's do letters. And so what we ended up doing, I had 3 committees. So we had one letter that's the investor letter. We had one letter that was the executives letter, and one letter that was the access, making sure we have access to actual care. So sort of on the ground, community providers. And so we started doing these meetings to talk about, okay, what are the key issues? Then I would draft up the letter. We'd have edits back and forth. And then we would get each letter done. And once each letter was done, I blasted it like crazy, and people just started signing on. And so, I mean, over time, it was thousands. And so we submitted those into the White House process. And I think that's when I started to see there's real interest and people are looking for how do we engage in government? How do we contribute to this? And that was a big wake up call. And then we get through that. And then 2024, I said it in January at JP Morgan when I spoke at the Women's Health panel, 2024 is the year of women's health. And it really was. It was like all about women's health in so many wonderful ways. And we then did another letter to then not just send to the White House, but to Congress to make sure Congress had the right information on key gaps in women's health and things that they could do about policy changes that they could do. All this organizing, bringing people together to come up with these arguments and information, that really showed me that there's something here. We need to do something with this community and don't make it reliant on one elected official, right? This is bigger than that. And even First Lady Biden has said it. I know people have been working for decades on this, and this is bigger than me, to her credit. And so that is what I think I've been able to tap into, is that people are really interested, they care deeply, and they just need a little bit of assistance, direction on how do I direct that into government? How do I make this work to connect to government to actually make a difference? And so, I don't know. That's how we got to where we are, I think.
I love that. Actually, that gives a lot of clues on how, just following the energy of what's happening and what's needed. And a simple intention in the beginning was just to bring to different key players together. And of course, there was a lot of momentum and desire for that. That's actually really cool to hear you speak of it in that way in the beginning. Can you tell us a little bit about where we're at with the Breast Cancer Early Detection Coalition, and what current movements we have and what bills we're working on and why? I'll just sort of let you pick up where you feel is relevant and give us that update.
One thing I'd like to share about this, we actually started the Breast Cancer Early Detection Coalition at the end of last year, so even before Women's Health Advocates. And the reason why is amazing people like Sheila McHale. Sheila McHale came to me a couple years ago. She had a horrific breast cancer story. She wasn't believed. Female doctor telling her she's creating a ruckus because she wanted to push for additional screening. When she saw a dent in her own breast, the doctor was insisting, it's probably fine, it's just that one side. She's like, no, I should get the whole. And sure enough, it was breast cancer in both breasts. The whole thing every time. And then when it came to getting the surgery, if she had to fight to get that, and then, her margins. Anyway, she really educated me on just how important your breast density is. I don't think I knew much at all. I thought, I'm starting to do my mammograms. Okay. And so to her credit, I teamed up with her. We did a congressional briefing on breast cancer, amazing speakers. She introduced me to the Brem Foundation. Dr. Rachel Brem is another amazing leader. She runs the Brem Foundation to defeat breast cancer. Claire Doherty is the executive director of that. Also got to meet Leslie Yerger, who runs My Density Matters, and many other people who were real leaders in this, sharing their stories to try to make a difference. And I was able to sort of pull them together. And how do we communicate and work with Congress? And so we did a big push end of last year to get more and more co-sponsors for the Find It Early Act. And we launched this coalition. We used that. We really built this up, and it worked. We had a surge in members, bipartisan members, joining onto that bill, which is great. However, every time you have a new Congress, which is every 2 years, you have to start all over again with these bills. So we had to reintroduce it. So at the end of last year, we also were able to get 2 senators to introduce the same bill. So Klobuchar and Dr. Marshall are the 2 senators. They introduced theirs. We were getting momentum on the House version. That's by Congresswoman DeLauro and Congressman Fitzpatrick. But then new Congress have to start over. So in this new Congress, within the first part of the year, I think it was maybe April, we got the Senate version introduced. And the House version, we were still waiting, doing some tweaks to make sure that it was truly comprehensive across all insurance coverage for supplemental screening, which means women with dense breasts, which is up to about 40-50% of all women, a mammogram alone will miss it half the time. So you need additional screening or supplemental screening, which is an ultrasound, MRI, molecular breast imaging. There's other technologies that are totally in the marketplace. None of this is experimental. It's totally out there.
Exactly.
There's nothing crazy about it. It's just you have to get the doctor to say, okay, you need that, and then get it covered by insurance. So that's what this legislation does. It ensures no matter what, you get that covered. So it's been a crazy year. There's been a lot going on, new administration, all kinds of things happening. So October, as Breast Cancer Awareness Month, was the month that the House version was going to be reintroduced. Well, then we have this thing called the shutdown that stopped all that. So we've had it delayed. However, our coalition used the month of October to do Zoom calls. We did like our Zoom Hill meetings, Zoom Hill Day, where we helped each one set up their own meetings with their members of Congress and then gave them the PowerPoint presentation to go through, chance to share their story. And it's working. I am getting CC'd on these emails and we're getting new co-sponsors because people did that. So when they go back into session, the House version will be introduced and there will be a bunch of new co-sponsors because of the advocacy of folks like you. So,
wow. That is really cool. So yeah, and that's just the one bill, which is actually a really significant one. I don't want to bypass that because that is the insurance covering the supplemental screening. Because right now, a lot of women that's a huge barrier to that next level of care and screening for women with dense breast tissue when a mammogram alone is not enough. She actually doesn't know unless she gets that supplemental screening whether or not she has breast cancer, not confidently, right? And not being able to have access to that, being told that you have to pay another copay or an out-of-pocket expense, which can be up to, $300 plus. I know when I was first told I had dense breast tissue, they told me it was going to be $300 out of pocket and that it was also then going to be another fee to have a radiologist look at it. So, and I had no idea what that was even going to cost. Yeah. So it's kind of outrageous to really think about, never mind, all the other things, another day off work, finding another babysitter, telling my boss that I got to go again. It's just all these reasons that you find to put it off or think you'll get to it later. And you really can't. It's actually critical that you get that second screening. And so I think anything we can do to remove that barrier is actually huge. And like you said, we know what the issue is. This isn't, we don't actually even need a whole lot more research. We just need resources and money and the approval to go get it done. So it's out there. And in the meantime, we need to advocate for it. We need to speak up and feel confident in asking for it. Like, your friend that you were just describing, a story like that can just really change the trajectory of everything. And look where it's gotten us. So that's really powerful. And I will say that I had a very similar experience in that I didn't know I had breast cancer in my left breast. And we only found a very small piece of insignificant, small little tumor on my right breast. And we only saw it because it was very close to the surface of my skin because my breasts were so dense. So we were lucky that alerted us. But again, I had to fight for that double mastectomy. And it wasn't until after the double mastectomy that my surgeon called me and said my left breast was loaded with breast cancer that nobody ever saw. And if I hadn't have fought for that, I would be in such a different place today. I would not be where I am today. And it's what keeps me up at night. It's what makes me do the work I do. I thought, how did I not know this? My mom has breast cancer. I thought I was well informed and I didn't know this. This is absurd and scary.
Very scary.
So anything.
Very scary. Yeah. And on the plus side, with accurate early detection, we can all survive this. Right? It's like 95, 99% survivable. And it's even in the interest of our economy and our insurance companies because it's like $250,000 or something that is spent on the treatment when it is caught late. And that's not even including the indirect cost. That's just the direct hospital. So it's a win-win all around if we enable every single woman and man to access the screening that is needed for their tissue type. It's 100% win-win all around.
Yeah. Oh my gosh. Exactly. And it just doesn't seem like it should be that hard. But in the meantime, I think these conversations are super important, much like the letter that, is going out now, thank goodness. But it took us a while to get that enacted. To just notify women of dense breast tissue, which is, again, why this conversation is important, because a lot of women are now receiving these letters and wondering what to do with them. And so the next logical piece is that, okay, yes, you need this extra screening, but also let's cover it for you so that it make sense.
Exactly. And just to clarify, so as of September 2024, every single woman, when she gets a mammogram, must be told her breast density. So everyone, make sure you're getting that letter. And then you're asking your doctor about it. What does this mean for me? What screening do I need to have? Because you're right. Because right now it's like people get the letter. They're sort of like, what? So we got to advocate for ourselves. Yeah,
absolutely. Okay. So tell me about your vision or the future of women's health advocates.
It's a beautiful vision. I am super energized that we're in all 50 states and it keeps growing every week. We keep getting more and more people signing up. And so that shows me that there's real interest across the country in people. It's not just women, it's all people wanting to learn more about women's health policy, women's health funding, and then what they can do to shape that. And so I think when we do next year's Capitol Hill Day, we're going to have even more people. We're going to be visiting with even more offices, and we're going to really elevate this. I want to get to the point where every member of Congress feels like, yeah, women's health. Oh, yeah. It's like an automatic because they're so used to seeing us, and that's the royal us. That's you, me. That's this whole community. They're hearing from their constituents, whether they're in D.C., they go home to the district, they do a town hall, and there's a question about women's health, right? Everywhere they go, there's something about women's health. That's what I want. And then ultimately, the ultimate dream is eventually we get to a point where it's not like health and women's health, but it's like all of health, right? What's our needs, right? As human beings. So that's the dream. And I think men benefit from that. I mean, the more we get better data on this, the more we all benefit. So for example, women live on average 5 years longer than men. Well, what if there's something we could learn about estrogen or something that could help men live longer? Wouldn't they like that, right? So there's a win-win all around, more accurate medicine by just understanding these differences. So that's my vision, I guess. We get to that point where we have everyone engaged and then we don't even need to section it out because it's just automatic part of health.
Yeah, I love that. And that made me think of something that, yes, it's women's health advocates, but it's so nice to have the young men and the older men showing up with us alongside us at the Capitol. And you don't have to be a survivor or an expert. I mean, you could just be somebody that cares and for whatever reason and show up and still have an incredible impact. I know we had a young man on our team. It was great for him to just talk about what it was like to have the mentors in his life have to face breast cancer and what that meant for him. Yeah. It was really moving and actually very touching. And then I know that we had, some other men there, and I just thought this was really cool. And the next time I come to the Hill, I'm going to bring my brother, somebody, because I know that they care and it's for them too.
Yes. Exactly. 100%. Yep.
I love that.
Yeah.
Oh my goodness. So is there anything that we haven't discussed or that you'd like to share with the audience today that's either top of mind or just a message you want to share today before we wrap up this conversation?
So one other thought or takeaway is that it's working. So when we started this, within 1 month of launching our online advocacy tool, which are those letters, we had 1,000 letters. Now we've got 2,800 letters that went into Congress from their constituents. And as someone who worked on Capitol Hill for a member of Congress, I can tell you those letters are tallied up. And we will see, oh my gosh, boss, we got 20 letters, 50 letters on breast cancer. We got to do something. The boss will tell the staff, okay, go find the bills. What bill do we need to get onto? I mean, it literally makes a difference. And then as far as right now, we're in the middle of the funding process, which is called appropriations bills. So both the House and the Senate include language and funding levels that we advocated for from the beginning of the year. We, as lobbyists, I've got a team of lobbyists that worked with members of Congress, worked with staff to get language and funding lines in there. And then we had advocates send letters of support in. We had advocates come to Washington and do these meetings. That combination is what got us to where we are today, where we're seeing success in both the House and the Senate. At a time when they were putting out proposals to cut NIH by 40%, we are seeing a $30 million increase for the Office of Research on Women's Health, for example. We're seeing $1.5 billion for ARPA-H, which has the Sprint for Women's Health program within it. So we are seeing progress. So I want people to know it's not just pie in the sky. It actually is working. And it's that great combination of knowing how the legislative process works, how you can shape it, insert language, exert influence, along with constituents sending in letters, sharing their stories, meeting with folks in person. That combination is what makes it really successful.
So important to track the progress and share that. Tell me some of the other areas of women's health advocates that are growing right now so that we can direct people to the website and let them know what's happening and what they can look for and expect to when they log on.
So womenshealthadvocates.org, you can sign up. And when you sign up, we ask where you live so that we can align with members of Congress. But we also ask what areas you care about. And there's 11 different categories. And then there's a 12th that's a catch-all for anything else you wanted to add. And we do that so that we can be organized and set up committees around each of those areas. People are more than welcome to jump around, care about all of them, only one of them. It's totally up to you. But it's just for us to organize. I will say most people check at least 6, probably about half.
Wow.
All 11.
I really wanted to, and then I forced myself to just pick a couple. I thought, I can't be the only one picking all of these, right?
Yeah. So no, you're not. So a lot of people do. But I will say the number one issue that has been selected up to this point is menopause. Menopause is definitely hot right now, pun intended. So that's a big topic. But it's everything from menopause to maternal health to breast cancer. What else do we have in there? Oh, CMS reimbursement. A lot of people don't realize that CMS reimbursement is much lower if it's a female patient, even if it's essentially the same gynecological, urological surgery. And Dr. Jocelyn Fitzgerald is the master. She's the one that wrote a paper after studying over 100 different codes in the CMS reimbursement system and found this discrepancy. And she found, while on average, it's 30 to 40%, for some of them, it's up to 100, even 150% lower if it's a female patient. So it's crazy. So we have a committee on that, and we did a congressional briefing on that, and we're working sort of behind the scenes with CMS on changing that. But there really is, I think, something for everyone. Longevity, I mean, just all kinds of issues, mental health, anything in women's health we care about and we're trying to address. And if you don't see it, write it down. Like I said, we've got that 12th option, catch all. You can write anything in there that we don't address, because I do read those, and we want to make sure that we're meeting your needs. Like, this is our movement, right? Our effort. So we want to make sure that we're covering it all.
Oh my goodness, I love that. Yes, I can vouch for that. You absolutely do read everything, take it to heart, consider it. You're so open to feedback, which I think is incredible, a great sign of your leadership, but also really drives the way you can make an impact, is because you are listening to what is happening and what the needs are. And you actually have a way to address it. I think you move and are very quickly, very agile on a lot of these topics, which you have to be in this environment, which is kind of incredible to witness. So I'm glad I get to be part of it. And as that, I wonder, do you want to talk a little bit about the steering committee?
Oh, I'd love to. Yeah. So Lisa is on our steering committee. Thank you for that. So anyone can sign up. Doesn't matter how old you are, where you are. If you're in this country or not, anyone can sign up. We welcome all. And then we have a steering committee that is really driving the direction of what we're doing. That's where we get our speakers from. They give us insights on, ability to go deeper on issues. And it was a steering committee that decided that our first online congressional briefing be on menopause. And we actually had over 500 people for that. So that clearly was a very popular topic.
Incredible.
And then the steering committee members go to all our events that are out across the country for free. And then we have some special events. We've got in December, I'm going to get to see you. We've got a retreat coming up just for our steering committee and some private meetings with some members of Congress. So I think it's a great group. It's powerhouse leaders who are real change makers across the spectrum within the ecosystem. And it's an amazing group.
Yeah, it is. It's been such a great thing to be part of. I really look forward to the next time we get together and just seeing where this movement is going, cheering on all the other events that are happening around the country, witnessing the momentum, feeling like I'm a part of it, whether I can be directly involved in every single thing, which isn't possible, but somehow you do it. And it's just great just to be a part of something bigger, but just knowing that I can have an impact, even in a small way, to drive this forward is huge. And it feels really special. I'm really grateful to be part of it. I'm happy to share it with everybody and, get more people involved, because I think it's working. Like you said, it's working. And so it's great to be able to add more energy to it. And so I just really want to thank you for spending your time here with us today. I know your energy is precious. And so to be able to spend some time with you is such a gift. And I'm really, really honored by you, the work that you're doing, and just to be able to know you and be able to spend this time with you.
Right back at you. I feel the same way. You're amazing. You're inspiring. And I'm so glad that you joined Women's Health Advocates and we get to do all these great things together. So it's awesome.
Yes. Well, stay tuned, everybody. And I will leave all those links in the show notes. So go sign up and see what's going on. Very active on LinkedIn. I will leave that notes in the show notes. You can see everything that's happening, get minute by minute updates on there as well, and just see who else is a part of this incredible community.